In healthcare, we hear a lot about the high-tech gadgets and machinery, right? But what if I told you the two most powerful tools aren't tools at all? Today, we're diving into a couple of skills that are like clinical superpowers for every great nurse: observation and attention.
So let me just ask you this straight up. What do you think is a nurse's most important clinical tool? Is it the stethoscope, maybe a syringe, or one of those complex IV pumps? Just take a second and think about what your answer would be. The thing is, the answer isn't something you can hold in your hand. The most critical tool is actually a combination of two mental skills: the ability to observe things accurately and the power to direct your attention effectively. It's all about how a clinician sees the world and especially how they see their patient. Okay, so let's break down that first superpower, the art of seeing, or what we formally call clinical observation. This is without a doubt the absolute foundation of any patient assessment. Now, if you look it up in a textbook, you'll get a pretty formal definition. Something like the systematic and careful watching of behavior, events, or situations to collect information. The key word to latch onto there is systematic. This is definitely not just a casual glance. But let's cut through the jargon. At its very core, observation is simply this: watching and recording what a person does. That's it. It's direct, it's focused, and it's probably the purest form of objective data you can get before you even ask a single question. And this brings up a really crucial point. Great observation isn't passive. It's an active process. It has to be planned and systematic. You're not just looking around. You're actively using all of your senses: sight, hearing, even smell and touch, to pull in data. And you're recording it immediately so that it stays accurate and objective. So, if observation is a tool, how do we use it? Well, it turns out there's not just one way to do it. Think of it like you have 6 different lenses for a camera, and you choose the right one for the right situation to get the best possible picture. First up, you've got natural versus controlled observation. Natural is pretty much what it sounds like. You're watching a patient in their natural environment, like their hospital room, without getting in the way. It's really authentic. Controlled observation is the opposite. You set up a specific environment, maybe a quiet office for a memory test, to really limit the variables and get more precise data. Next, you have to decide: do you jump in or do you hang back? With participant observation, you might actually join in, say a group therapy session, to get a much deeper firsthand feel for what's happening. The big risk there? You might get biased. With non-participant observation, you're a fly on the wall watching from a distance. It's much more objective, but you do risk missing some of that important emotional context. And finally, you can choose between structured or unstructured. Think of structured observation like using a checklist. You have a pre-planned tool, like a pain scale, that helps you gather data that's consistent and easy to compare. Unstructured is more like working with a blank notebook. You're observing freely, taking general notes. It gives you a ton of flexibility, but you have to be really careful you don't miss key details. Okay, so we've talked about how to see, but it's not enough to just see everything that's going on. You have to be able to focus on what truly matters. And that brings us to our second superpower, the science of focus, otherwise known as attention. The official definition describes attention as the process of focusing on one stimulus while actively ignoring others. In a chaotic clinical environment, being able to filter out all that background noise isn't just helpful, it's absolutely essential. Or let's put it even more simply, it's just the concentration of mind on something. But in nursing, where you direct that concentration can be the very thing that separates catching a subtle sign from missing a critical one. But here's the thing, not all attention is created equal. For both your day-to-day practice and for any exams you might take, it's so important to understand the 3 core types. So the big 3 are voluntary, involuntary, and habitual. Voluntary attention is the one that requires real effort and willpower, like when you are slowly and carefully calculating a medication dose. Involuntary attention is a reflex. It's that sudden, loud alarm from a monitor that instantly grabs your focus, whether you want it to or not. And habitual attention is the kind that becomes automatic with practice, like an experienced nurse who can just glance at an IV drip and know instinctively if the rate is right. And of course, in the real world, it all gets more complex. You use selective attention to tune out a noisy ward and focus just on the sound of one patient's breathing. You use divided attention when you're multitasking, charting notes while still actively listening to what a patient is telling you. And then there's sustained attention, which is that marathon level focus you need to monitor a critical patient for an entire shift. So, let's put this all together now. Observation and attention aren't two separate skills. They're a team. They're a combined process. And this link between seeing things and focusing on the right things is the absolute bedrock of patient safety. If you only remember one thing from all of this, let it be this mantra: see everything, focus on what matters. You use that broad, wide-angle observation to gather all the data, and then you use your sharp, focused attention to find the signal in the noise. Because when this process breaks down, the consequences can be incredibly serious. It creates this dangerous chain reaction. It might start with something as simple as fatigue or a distraction. That leads to poor attention, which then causes a missed observation, like a subtle change in a patient's skin color. And that single missed observation can lead directly to a critical error. And here it is, the bottom line, spelled out for us in the source material. Poor attention leads directly to medication errors. It is that simple, and it's that serious. All right, let's do a quick recap of the key takeaways you need to remember. First, observation is the first and most objective step in any assessment. Second, always remember that participant observation has the potential to introduce bias. Third, know those three core types of attention, inside and out: voluntary, involuntary, and habitual. And finally, don't forget that your attention can be affected by internal factors, like fatigue, and external factors, like noise. So, we've gone through the whole toolkit, the different lenses of observation, and the different types of attention. These aren't just abstract concepts from a book. They are real, practical skills that you can actively work on and improve. So the final question isn't for me, it's for you. Now that you know the tools, how are you going to sharpen your focus to see what others might miss?